Magarelli, CNY Fertility. Welcome to In Search of the Stork with Dr. Magarelli. Let's see where we're at here. Okay, we're live here. Welcome, everybody. Say hi, so I know you're out there. I like knowing you're out there. Hi. Hello, everyone. So today, hi, welcome. This is Dr. Magarelli, CNY Fertility. I'm right here in Chile, Colorado, in my little outside studio. It's kind of fun. I get to watch things. Hello, hi, Caitlin. Good to see you. Good to see you. That's my favorite lady with the longest name in history, Caitlin Sage Kirsting Puffer. I just love that. That's kind of a cool thing. And kind of hoping that the Instagram folks. Hey, Sarah. Hey, Dahlia. Hey, Amber. Good to see you. It was an amazing egg retrieval for me too today. Thank you, Amanda. Jordan. Good to see you. How are you, my dear? I hope everything is going fantastic. Let's see, Vanessa. Nice to see you. Hello, and Leah. Good to see you. Nicole. Tomorrow, Syracuse. You're gonna slam it out of the park, my dear. I'm sure you are. I'm not sure how Instagram is working here. It said there were 4 followers, but I don't see them. Oh, hang on. I just lost my Instagram feed here. Just give me a moment. I hope that's working for you folks out there. We're telling more followers to join. Tiffany, acupuncture. Good, Tiffany. I hope you enjoyed us. Maybe you can share it with us. Hey, Devin. Good to see you. And thank you. Yes, it's my favorite Tuesday talk. And you're 21 weeks ago. Come on, Jordan, baby. You can do it, my dear. You can do it. Tiffany, hi, Monet, and Joshuman. There's one of my favorite doctors. I can't say you're the favorite doctors, but you're one of my favorite doctors. Joshuman, we're trying to get him out here more. And congratulations, he's now licensed in New York. So you're going to see him helping the eggs get through. How was it, Amber? I signed up for a pre and post transfer. This is Amber asking. Well, I'm going to have Dr. Credenda, Diane Credenda, and Dr. Stephanie King, her new associate, is going to be talking to you all. I'm hoping within a month. We're going to get her on. They're going to get both of them, and I'm going to interview both of them on my Tuesday show, and man, that's going to be cool. And then the other thing is that next week is Everything Male. Everything Male is next week. Hi, Sonia. First timer. Glad you're here. Letitia. Hey, 9 weeks. Oh my God, we can't thank you enough for your faith in us. And Queen Mag, I love it when you're here, Queen Mag. Colin. So we're going to talk about everything male, fertility, testing, treating, sex. Of course, we're going to talk about sex and what you can do. This is the male. So this is your jobs, ladies, and most of you guys are ladies. Get those husbands, boyfriends, partners to join us next week, 4:30 to 5:30. It's everything male. So it's going to be kind of amazing. I hope it's amazing, and I hope it's eye-opening for the guys. The guys play such a strong and important role in fertility management and care. So you guys are 50% of the deal in terms of what's going to be. And yes, I'm going to add. Hi, Devin, a Nova girl here. Okay. I am going to answer your questions tonight. Is all questions and answers. I know, Lauren, you already got one there. So why don't I start and then jump in? So Lauren, what does your lining have to do to be before you start meds? No, that's not how it works. What I did a transfer on the 20th and it failed, going back into another transfer. Now they say my lining was 11 on Monday. I go for a recheck tomorrow morning. I had success. Okay. In an embryo transfer, a frozen embryo transfer, the minimum lining, hey, Jessica, the minimum lining that you want is 6.6 to 7 millimeters. The optimal or the mean lining is 10. The range is, from 6.6 to 16 is okay. It's not typically the lining. I did a big talk on that, I think, last week or the week before. So look at what I said. Nessa, hello, Nessa. Hey, it's Julie. Julie Booker. Good to see you, my dear. Thank you. Thank you for jumping on. I appreciate it. So let's start throwing out some, let's start doing some work. Okay, so hi, Wanda. Who wants to ask some questions? This is open forum. Any questions, any concerns? Queen Mag, I'm so upset. I was supposed to get an IUI this week. I was told my lining was 3 last month. It was at 11, but didn't have my trigger shot. Now it was 3. Okay. Okay. You said an IUI? We tend, you can add estrogen. Queen Mag, ask your doc to add estrogen. It's totally allowed in an IUI cycle, as long as they're going to trigger you. If you are doing an IUI, can you change to IVF mid-cycle, Monet? Well, Monet, the only reason you change to an IVF cycle would be because you're making too many eggs for an IUI. It is much better to plan ahead for an IVF cycle, but yeah, we've converted, it's called. We've converted from an IUI to an IVF. Wanda, what is better, gonal or follistim? There's no difference. Does Reiki, hi Reiki, does MTHFR usually need 30 or 40 milligrams of Lovenox for success? Now, MTHFR is a folic acid deficiency, has nothing to do with Lovenox. So make sure you're adding extra folic acid, you know, up to 1 milligram at least of methylated folic acid. Miscarriages are associated with the use of Lovenox, especially recurrent pregnancy loss from antiphospholipid antibody syndrome. Okay, Johanna, first time in my life missing a period. Can onitrope or LDN cause that? Well, Joanna, if you've gone through an IVF cycle, just the cycle itself can do it. Had our consult with Amy a couple of weeks ago. Excited to get starting. Fantastic. Nicole, lots of hydration before you go to bed. Eat some dessert before you go to bed tonight because you're going to be fasting tomorrow. That's my recommendation. And just breathe, okay? Is endometrium and prometrium the same? No. Those are very different brands in very different ways. The prometrium is an oral medication that we sometimes use inside the vagina. Endometrium is designed specifically for enhancing the uterus in preparation for IVF. Do you recommend waiting until the second dose of COVID vaccine to start stims? Well, let's see. That's a hard question, Stacy. But if you can, please do get that response. Remember, it's an immune response. It's a strong response. So if you can wait, fine. If not, we'll work around it with you. I haven't taken a prednisone in my life. I was very sick preemie. Will the prednisone prescribed in my cycle work like it should, or should I see it? No. Caitlin, no. There's no whether you were a preemie or not. Nothing to do with it. Hi, Priscilla. I had my blood work done at CNY. Whoops. I have not. Okay, Priscilla, she went by really quickly. So Priscilla, just contact us, call back, be patient, go on the, go on the portal. If they don't portal you, then call, the 800 number. Kelly Cooper, extra prayers would be lovely. Had an egg retrieval with no eggs. I'm sorry. They're looking better, but all the prayers are welcome. I'll send the prayer out to you. Nicole, okay, great. Monet, my right follicle isn't big enough, and my left has 2 follicles, but my tubes are blocked. That's why I changed to IVF. Oh, okay. Well, that's a good reason. So you're just trying to optimize, and again, I don't know your whole story. Hey, Donna Miller from the Global Travel Team. She's our queen. You got to thank that lovely lady because, quite frankly, she makes everything work. Don't think the doctors do. Honestly, it's the Global Travel Team. It's the call team. It's the Nurse Online team. We doctors have it really easy. So everybody to Donna. Okay. Transfer will be Friday. Anything else I can be doing? Keto, acupuncture, HCG, lipids. Yes, breathe. Remember that the body wants you to be pregnant. You're not fighting nature. Citratide and Gardalex the same. Well, they're the same function, Judith. They actually function the same. They shut off the body's natural desire to release eggs, and we don't want to do that until they're ready. So yeah, those are equivalent. Does assisted hatching have higher success rate, Mandy? Well, historically that's been true, but now that everybody's doing ICSI, where we place a hole through the zona pellucida to put the sperm in. They're doing hatching. Pretty much, we do hatching on everybody at UNCNY. So historically, there was a suggestion that it was better. The data are not very good. 29, AMH 4.4, is that low? No, Carly, fantastic, good job. Kelly, brain stopped working. Forgot to say I'm having my second retrieval Thursday. I don't know what your brain stopped, but I don't know what you're talking about. What millimeters must follicles be in order to trigger? Well, again, a little bit of chef work. East Coast, maybe 17, 18 millimeters. Up in the mountains here, 18, 19 millimeters. But again, it's the judgment of not only what millimeter, but we have to look at the population of follicles that you have, and we want to have at least 50% above 17 so that we're ready to get as many eggs or optimal number of eggs. When do you recommend the acupuncture, Monet? Absolutely. You're welcome, Judith. Absolutely. You do acupuncture. The studies that we did, it's best to do it up to 3 months before your retrieval or transfer. Certainly 6 weeks, you should be starting, 1 or 2 treatments per week. You need about 9 or 11 before the eggs come out. And if you're doing frozen embryo transfer, you need about 6 or 9. Nefertiti, if it's determined that some eggs were not mature enough at retrieval, does that possibly mean the retrieval was done too early, or does that mean poor egg quality? Neither, Nefertiti. You should expect a distribution of eggs when you do a retrieval. The majority you want to be mature, but then you're going to get some that are going to be immature. You're going to get some that are going to be post-mature, but you're trying to optimize. There is no way. Now, if 100% of them are immature, fine. Then wait another day. If 100% are post-mature, fine. Save a few days. But typically, you're going to get a distribution of immature, mature, and post-mature. Carrie, we had our first Ivf cycle fail, 6 eggs fertilized, but no blast. Doctor is recommending what egg quality mentioned using Omnitrope. Yes, Omnitrope is nothing but growth hormone. That is the only studied adjunct to low ovarian reserve that has been proven to increase pregnancy outcomes. It's also been shown to enhance, the kinds of eggs that you get. So it is important to use Omnitrope or Sizin, growth hormone, all the same. So yes. Weather, we have no snow, not here in Colorado Springs. I mean, everything melted off, so come on down. What are the ideal levels of estrogen at retrieval? No. There's no ideal, Kelly, estrogen level. It's related to the number of eggs that you have, and also it's relative to the medications that you're using. So the estrogen level doesn't correlate as much as the follicle size. Amber, is pre and post transfer acupuncture beneficial? If you haven't, absolutely. That's where all the original studies came in, Amber. That was studies by Plaulis. The Plaulis study was pre and post. Now, it's much better, of course, to do longer. And the ideal number is 9 or more cycles. Ola Kachuaka, Brenda, I can't say it. I have 2 daughters and I need a son. It's called IVF. Oh, no. Are there other means of conceiving a boy without IVF? No, not in the United States. How long should you use HGH before retrieval? Well, here's the interesting thing, Caitlin. It's the studies were actually just the first 11 or 12 days of the stimulation. Some studies looked at 21 days, and we very much believe 3 months because that's the recruitment. But there's no number that's been proven to be a number. You do the best you can. Is there any way I can boost my follicles other than FolliStim? No. If you're doing IVF, you mean? I'm assuming FolliStim, gonadotropin. They're just gonadotropins. There's the stuff that there's the stuff, that's the stuff that grows follicles. You want to grow stuff. Hillary, what would be the steps when doing a frozen embryo frozen embryo transfer, not frozen egg? Well, it's about 17, you're going to be on estrogen plus progesterone, probably on growth hormone, probably on low-dose naltrexone, probably on prednisone, probably on acupuncture, probably on the keto diet. These are the things you can do. And so you'll get about 10 or 11 or 12 days of estrogen. And then once the progesterone starts, you need exactly 6 days of the progesterone, unless you've done what's called an endometrial receptivity assay. If you've done that, then of course we know precisely how many hours you need to get the progesterone prior to the transfer. Carrie, due to failed Ivf cycle with no blast, only multicell on day 5, and doctor is concerned about egg quality, would you recommend PGS? No. If you can't get to day 5, I would say, Carrie, make a baby, put them in on day 3 fresh. And then at some point, if there really is an issue with regards to eggs, you may have to consider donor eggs. Deledora, husband is experiencing some bad effects of Clomid. That's odd. You'll have to tell me what that is. Don't know about that. So maybe tell me what the bad effects. Yes, he could take letrozole. That's another thing. He could take HCG. Okay, Sarah, see you soon. Mimi, an ovarian cyst. My gyno thinks it's a hemorrhagic type. What did I miss? There must be more to it. Should a laparoscopy be done before or after egg retrieval for an IVF if I have a fibroid? Not for a fibroid. Any surgery should be put off until you guys can make embryos. Remember, the uterus doesn't age, so you can, that's a good thing, right? Because the uterus doesn't age up to age 75, people can carry. But the ovaries lose eggs at about a clip of about 1,000 eggs a month from 13 to age 35. And then after that, it's about 10,000 eggs a month. So, your goal, I guess, how do I say this? You're not your goal, but what you want to do is make as many embryos and get them in storage and then do your surgery. I mean, that's about the best way I can say it. And if the hemorrhagic cyst is in the way of getting eggs, then of course you want to make sure it's out of the way, and that's surgery. Emily, IUI Thursday, only one follicle. Great. What are the chances of success? Emily, how old are you? And are there any sperm issues? Hey, Kelly. Oh, I'm so happy. 19 weeks. Fabulous. Just, I wish you the best and stay in touch. Amy, we previously did IUI twice and ICSI 3 times at Walter Reed with our last pregnancy ending on 20 weeks with twins. I'm so sorry. The first intake and the second one. Okay. Does CYN allow you to do all your preconception testing labs at a facility? No, absolutely. CNY is dedicated to empowering all of the OBGYNs in the United States to work as your advocates so that they can provide you local, high quality ultrasounds, blood work, testing. We work with everyone. We work with everyone. So we definitely want to work with your OBGYN, everybody. If it's convenient for you guys to get your testing and your preconception testing and your hysteroscopes and your HSGs and all of that, definitely reach out to them, or even tell us who to reach out to. And if you look at our website and you look at the local monitoring page, it is amazing how many folks around the country are helping us help you, and they're wonderful. Ladora, tell your husband that stop the Clomid if he's having chest pains, and go to the hospital. Struggling to find a monitoring doctor in my area. My OBGYN says no. Best way to find the right doctor, Melissa? Well, what's the best way? Tell me what state you're in, and I can give you an idea. Barney Burnell State, thank you for making my dreams come true. Oh, God. Oh, I'm so happy for you. Thank you guys for jumping on here and telling me good stories, which, by the way, are so inspirational to all the young women and couples and people that are just struggling with this process. So yes, please tell us your good stories. Christine, are you okay with transferring 2 embryos after a failed transfer? I'm 28. Are they untested? Likely I would do it. Oh, Napa Valley, California. So Sacramento or San Francisco. Sacramento, if you go look at the map, we've got a whole bunch of facilities in Sacramento, a whole bunch of facilities in San Francisco, somewhere in between there. So go to our website and go to the local monitoring page there, and somebody can give us the link to that. You can get things done at CNY too, of course, Tiffany, always. I need help with finding monitoring too. Yes, so go to the website, see what's there, and if not, talk to the well, we will have the global travel team help you. There you go. Looking for an OB in the Colorado area. Well, we got a wonderful OBs all over Colorado Springs. Absolutely. I heard frozen transfers are more successful than fresh. Well, Monet, not necessarily. Everybody has a story, and you really want to have that personalized treatment. Historically, which is really just 10 years ago, everyone thought frozen were better than fresh. It's just because of studies. Well, we shift, we change, we grow, and now we're a little less dogmatic where frozen is better than fresh. Some cases it is, some cases it is not. Anna, I've had 2 prior miscarriages conceived on Clomid and Letrozole, first cycle IVF 2 months ago. Successful, but ended another miscarriage. Embryos were tested and it was normal. How will I know if I'm able to carry a successful all blood clotting work and testing shows nothing is wrong? Well, Anna, you might want to get 2 things. You might want to get a really high-end ultrasound to see if you have adenomyosis. You might want to have a diagnostic laparoscopy for endometriosis. If you look at my talk last week, we talked about that. And those are 2 things. You should be doing acupuncture. One of the key things that traditional Chinese medicine helps you with is the reduction of miscarriages and the delivery of a baby. Dr. Credenda and I, she's at East Winds Acupuncture, she and I did a lot of research looking at miscarriage rates as well as ectopic rates and birth rates, etc. And by adding acupuncture, everything is optimized, or many things are optimized. So consider acupuncture. I just finished doing a talk for the Yosan University students. Shout out to them. These are PhD level acupuncturists in training, and did a nice review of even traditional Chinese medicine in the form of herbs. I'm feeling more and more comfortable that that may be a way to help our patients who are, unsuccessful, who are unsuccessful, and this may help them. My hubby's sperm morphology is 0. Should we be concerned? What do you suggest to improve his sperm quality? No alcohol, no tobacco, no street drugs. Go to CNY Fertility, download the family building guide, look at the vitamins that are there for him. He should avoid alcohol, tobacco, drugs of all sorts. Acupuncture certainly is helpful. Paula, if you have a copy of the gene, are you still okay to take Neupogen? Those are not related. Sorry, those are not related. Do labs at LabCorp request and ultrasounds at an oh, do that. Yes, I agree. If my HSG and scope are normal, can we be sure I don't have endometriosis? Absolutely not, Mark. The reason is endometriosis is inside the body. Hysterosalpingogram and hysteroscopy are looking at just the cavity. So no, you need a diagnostic laparoscopy. Idalia, I was already in treatment for infertility and had 1 failed IUI due to a blocked tube, so I am switching to IVF. My first consultation is April. How long after the first consultation can I begin? My last HSG, will I have to do this again? No, you won't have to do the HSG again. But what I would recommend is you call ahead and say, can I get my preconception testing updated? Even before you see the doctor on the first visit. Can I order my hysteroscopy, hysterosonogram? You just say, hey guys, I want to be prepared. Nicole, I did a transfer in 2019, gave birth to a beautiful baby girl, and now are ready for a new. What do we need to do to start? Call CNY Fertility and just set up an appointment. Prometrium is much cheaper. It says here, Prometrium is much cheaper here. Hang on, I'm having problems with my Instagram here thing. See if I can get that live here. Go. I lost my train of thought. I had a polyp removed and my doctor recommended I have PRP. Let me see if I don't know how to slide that down. Oh, yes, I do. It's going by too fast. I'm going to start at the bottom. I use ancient Chinese herb mix to dissolve a hydro at work, but still have scar tissue. Love Chinese medicine. Okay. Should we have intercourse during priming? You should have intercourse. Yes. How fast do the results from monitoring have to go to CNY? Well, you should get them there the same day. That's really helpful for any place because that's how it works. I'm 36, husband has low sperm count, is coming back, last specimen, 311 million. So we have some in case specimen Thursday. Original question was IUI success rate with only one follicle and sperm issues. It's about 2 or 3%. I just had a polyp removed. I have PRP. Is that a procedure? Is that a procedure? I have a P. Okay. Is that procedure necessary? No, no. It is optional. How does Plaquenil help? Well, Reiki, what I would strongly recommend, and I can go into the details, is go to CNY Fertility, Family Building Guide. Every single drug you're on tells you exactly what it is and how it works. So it's really worth it to go to CNY Fertility, download the Family Building Guide, and just read. Is there anything you can do to help scar tissue from forming? Jessica, I'm assuming inside your uterus. Actually, there's nothing Western medicine can offer, but I'm pretty sure that if you talk to a traditional Chinese medicine doc, they probably have a good idea. You're very welcome, Ricky. All right, I just had a polyp removed. We went through there. Yeah, I'll have to find out what's going on with the live on Instagram, and I apologize to my Instagram people. Uterine PRP. Yeah, I mean, again, that's an option. That's just an option. Guys, a lot of what we offer, all of what we offer are options that you can pick and choose. I mean, we'll give you reasons. You're welcome, Amber. But honestly, if you read the Family Building Guide and you look at these lives, our goal is to provide the most advanced stuff that we can, even if it's a little bit outside the box. I mean, one of the things that CNY really prides itself on is we think outside the box, led by Dr. Robert Kiltz, who literally lives outside the box. And I'm sure if you know him, you know what I'm talking about. So it is important to understand your medications, understand the process. And honestly, I have reviewed everything on the educational side of the web at CNY Fertility resource page. And man, a lot of great information. Monet, did you say there's a 2 to 3% success rate? Yes, Monet, about 2 to 3% success rate. The best you can do with IUI worldwide is about 8%. You know, Paul, I can't give you the answer about the contraindications on Neupogen. That's something that you can contact the office about. A little too complex right here. Does low vitamin D cause issues with infertility? Okay, great. Absolutely, yes. I think I did a talk on supplements. You can, and I talked specifically about vitamin D. You want to do about 5,000 international units of, or is it million international units of vitamin D a day. Some people take up to 50,000 who are very deficient, but absolutely. Just curious what your thoughts are on 4-day transfer as opposed to 3 or 5. I don't have any thoughts about that, Sandy, if that's convenient for you. Remember, the embryo, once it's inside the uterus, will float around until approximately day 7, 8, 9, timing-wise, where it will implant. So even if you put in a day 5 or 6, they're going to float around for at least 24 hours. My husband may be gone for extended. How does freezing work? Will it be just one cycle, or can we freeze for multiple cycles ahead of time, Tiffany? So once, if he's going to be gone, your husband, we need to freeze his sperm, whole bunches of it, so that you have that as a backup. You don't need to freeze the eggs, you freeze the sperm, and then you fertilize. I don't care if he's there or not. We don't need him, right? Because quite frankly, we need a sperm. Okay, you're the egg provider and the host. Of course, we want them there because they're important. But the bottom line is make sure you have some frozen sperm, not frozen eggs. Mark, is estrase and prometrium act like birth control? If so, should we still have intercourse during priming? Wait a second. Well, you mean, Mark, there's a difference between procreation and recreation. So procreation, no, you're not going to get pregnant if you're on estrase and prometrium. Recreation is recreation. So those are not related. So priming medications affect the baby if we got pregnant. No, that's pure estrogen, pure progesterone. Those are critically important for a pregnancy. So the answer is no, they do not. I got my orders for labs and HSG and sonogram. Do they need to be done on a particular day of my cycle? Well, we like your labs, Ashley, to be done on day 2, 3, 4 of your menstrual cycle, the blood work. And we like the uterus evaluated on days 8, 9, 10, or 11. Laura, do you recommend a break between transfer or retrievals? Never. You're losing 10,000 eggs a month, or at least 1,000 eggs a month, Laura. Believe me, you want to do back to back. That's what we call it. Just jump right back on that horse, and let's get those babies made. Okay. Okay. I'm on birth, Amy. I'm on birth control pills for cysts right now, and it makes me feel awful. Are there any other options to calm PCOS? Yeah, calm PCOS. Oh, because you make cysts. Not really. Not really. Now, there are 100 different brands of birth control pills, or you can do estradiol and prometrium, as we've discussed before. So you could maybe shift to estradiol and prometrium. Andrea, are IUIs successful with just Clomid, no ultrasound or trigger shots? No, they're dangerous. They're actually sometimes can be dangerous, meaning if you are looking to try to get triplets, quadruplets, and quintuplets, the number one way to do it is unmonitored Clomid cycles. That is not a good thing. And plus, you should never do Clomid for more than 3 cycles without a break, because then it acts like a birth control pill. Is your monitoring center in Philadelphia open? I think yes. I saw beautiful pictures today. I'm pretty darn sure. So call up our 800 number and ask them. But yeah, welcome Philadelphians. Welcome Pennsylvanians. Welcome you guys. Okay. How many times do you recommend doing IUIs? I've had 2 unsuccessful. Ziara, judging from your picture, I don't know how old you are, so let's assume you're less than 30. Up to 6 IUIs, and then you're kind of done for life. Hillary, reaction of redness, swelling, fever, and rash for injection before the transfer can be a reason it wasn't a success. Oh, I don't know who's answering that. Oh, thank you, Chris Ann Martinez. I am well. Thank you for saying I look good. I think it's my new haircut. I was getting really shaggy. It must be my new haircut. Dr. Kills liked my haircut, so it must be okay, right? Right. If you know Dr. Hills, you know why that's funny. Okay. I'm going to take another drink. Now, this is water. Isn't it wonderful? We're opening up all these crazy centers all over the country. Looking at Sarasota, looking at Miami, looking at Philadelphia, New Jersey, near Denver. I mean, it's going to be a while, but, we're just growing. We're all growing. Do you recommend a break between IVF cycles? Carly, I thought I answered that, but no. If you're losing 1,000 eggs a month, the last thing you want to do is not collect them if you can. Now, if you need a mental health break, a sex break so that you guys can have sex again and not worry about it, if you need it simply to take a break financially, absolutely, you do what you need to do. Anna, if my time difference is 6 hours different than New York for FET, should I take the meds my time or New York time to keep it consistent as possible? Okay. No, I don't know. That's a great question. Let's see. 6 hours. Where the heck do you live that it's 6 hours difference? Like not Hawaii. Where do you live, Anna? Do you have a monitoring center in New Jersey? It's coming. Not yet, but it's coming. I can tell you it's on the books. I have 2 embryos left. Would you recommend a transfer, one or both? Laura, how old are you? This would be my 3rd transfer, miscarried on 6 weeks. I'm so sorry, and 2nd failed. Yeah, I mean, yeah, I think it's reasonable if you've had that history to do 2. Again, it's outside the rules, but we will work with you on that. Deanna, what are the causes of poor response during a stim? My AMH is 1.4 and FSH is 12. I'm 38 years old and only 2. Yeah, well, you kind of answered the question. you have a low AMH, low ovarian reserve. You have a high FSH, low ovarian reserve. You are 38 years old, low ovarian reserve. So you're normal. So it's not a poor response. It's a consistent response to it's a consistent response to where your age is at and where your parameters tell us you are. I have a septum removed from my uterus. How will this affect it or improve your chances, Jessica? Because a septum, the septum really can interfere with implantation. A septum can interfere with carrying the baby. So Melissa, thoughts on starting stims later in the cycle, around cycle day 14? Well, my thoughts about it is, if you have cancer, of course, that would be something you would be forced to do, but it's always ideal to start it on the second, third, or fourth day of your menstrual cycle, because that's the first and major wave for mammals, Homo sapiens, man, to recruit. Do high-dose stim protocols damage egg quality? No, Anna, no. That's been looked at forever. It's been controversial, but nope, nope, and did I say nope? Nope. Because what you're considering high dose is relative to something else. We need a dose that's going to allow your body to break through its resistance to having more than one follicle mature an egg. Our goal is to have you mature as many eggs as possible. Do you recommend you have an HSG and a hysteroscope if they are a little over a year old? You know, Cecilia, not if they're a little over a year old and you don't have a history of miscarriages, sure. Can taking progesterone 2 in affect anything? Don't know what that is. Prog 2-2, don't know. How do you adjust medical timing? How do you adjust medicine timing for daylight savings? We are not that precise. Don't worry about it. It's morning or night and not the time of day, typically in an IVF cycle. Early. What does Reiki early mean? Oh, too early affected. No, guys, don't get caught up on this stuff. Progesterone and oil and vaginal progesterone, you know, you got more than 24 hours worth. Your fertility medicines, you have up to about 24 hours worth of effect. So don't get too tied up in minute by minute. Hello, Dr. Magarelli. Do you know anything of a national pharmacies to address pregnant shortages for patients in need of limited gonadotropins? Well, Digi, well, Fertility Pharmacy of America, I would try them. That's what I would do. I would try them. Freedom Pharmacy is another one. But yeah, I mean, when something's when there's a shortage, there's a shortage, but you know, there's not only one brand of HCG, so I would continue to just look on the net, but talk to the nurses, or they should be able to give you a heads up on that. Yeah. Is it better to freeze? I almost got that one. It disappeared again. Okay. You're welcome. When should I start Lovenox for a fresh transfer? Typically, the Lovenox, well, it depends, okay? So the Lovenox for a fresh transfer, that's going to be something that you and the nurse will work relative to your retrieval. So they will give you that schedule, okay? Are any of the doctors prescribing subcutaneous? No, never subcutaneous, Robinson. Never, never, never. You are going to be in a whole hell of a lot of pain. If you put progesterone and oil under your skin, you're gonna really not like that. It's an intramuscular shot. That is how it works. So make sure it's intramuscular, but it could be in the arm, it could be in the thigh, but you definitely don't want to put it under the skin. No, that's not good. That's not good. All righty. Any other questions? Do you check integrity? Whoa. I don't know what that is. Do you tech integrity? Don't know that. Any doctor's prescription? No. Is it better to freeze my eggs or embryos to have it? Okay, Melissa, is it better to freeze my eggs or freeze my eggs as embryos? Embryos is always better, always better. And the reason for that is that an egg, no matter what age you are, is a minimum of 50% of them are abnormal. So you want to know what you're freezing. Okay, so knowing you have an embryo is probably 10 or 20 times better. Oh, Hawaii, yes, Hawaii. Trying to keep the timing close to the same as possible. I've had 2 failed transfers. I'm wondering if time was too offset. What does you suggest for time difference on meds? Should we take it, change it? You know, gosh darn it, come out to the clinic on when you're at your progesterone start and stay a week and just get it all come in 7 days before your transfer, okay? And then start your progesterone medicine so it's precisely timed to the time of day. But I got to tell you, Anna, the likelihood that any of that has to do with a failure is extraordinarily low. And aloha, okay? I used to live in Waimanalo, by the way. I spent there a couple of years there working at the Oceanic Institute, you know, where they train the dolphins and stuff. Yeah, I worked there for a couple of years. Okay, Amber, is heating or icing the site before PIO better? I've been saying they do both. I've seen. Okay, don't know. Nurses jump in. I've noticed now that I didn't have my FSH checked prior to my first Ivf cycle. No, Carrie, I don't know why you want your FSH checked. If they already know what your AMH is, FSH is not that important. On my day 2 baseline ultrasound, they saw an 18 millimeter and 16 in my right ovary. Why is that? Well, you're out of sync. You have some leftover. Yeah, Jessica, they can be checked each time, but I'm not exactly sure that it's going to change your course of care. Diana, it's okay to switch to timed intercourse after a canceled eggs retrieval due to poor response. Can I successful recurrent pregnancy issues? Is it okay to switch to timed intercourse? That's your choice. Yeah, that's your choice. Hi, Doc. I'm 26, 6-year-old naturally with no issues. I've been trying to get pregnant for 3 years. I'm sorry. Did 1 round of IVF for 17 eggs, only 2 embryos. Any suggestions for round 2? Apparently, I have PCOS now, but have regular periods. Okay. So, egg, sperm, uterus are reasons why people have problems, and sometimes hormones. So, again, lifestyle, alcohol, tobacco, drug use in a male affects miscarriage rates in a female. Same thing with you doing it. Acupuncture, traditional Chinese medicine. If you can't get it locally, then go to our Healing Arts Center in Syracuse, Albany, or just go to the American Board of Oriental Reproductive Medicine, www.aborm.org, and get a board-certified acupuncturist there. That would be another helpful place to go. Your keto, approach a keto diet. Have you been checked for endometriosis? Laparoscopy. How controlled are you with sugars? You know, too much sugar for PCOS, deadly. Can you test a frozen embryo for chromosomal abnormalities? Yeah, sure. Just ask us. Is AMH 1.8 and FSH 10 and 30 for low ovarian reserve? Yes. Yes, that is low ovarian reserve. I don't know what a different protocol is. For my icing first and heat after works best. Thank you, Jody. Thank you. How far in advance should we send a Siemens sample before retrieval? 2 weeks. 2 weeks in the office. 2 weeks in the office. Before, well, actually, we like 2 weeks before you start your stim. So we definitely want it there early enough so that we're not going to be panicking. So everything at least 2 weeks, if not sooner, as soon as you can. Anna, I know that high FSH isn't great, but what does it mean if FSH levels are very low? Usually it's taken in the wrong time of the cycle. Is hatching good or not with a frozen embryo? It doesn't matter whether it's fresh or frozen. Martin, thank you for all the wonderful work. You're a true blessing. Thank you. Waiting for my consultation. South Florida. I have a diffuse adenomyosis. I had 1 chemical and 2 miscarriages. Do you have any recommendations? Yes. 3 months of Lupron. 3 months of Lupron. 3 months. Did I say 3 months of Lupron? Yeah. 3 months of Depo Lupron, if you can. I don't know enough about you, Martine, But that is I just did a talk for another person, and so yes. Does that mean I'm gonna Mark? Does that mean I'm gonna ovulate early? My guess is those are cysts. If it's really truly your day 3, Mark, it's probably just cysts. All right. So Anna, just make sure that they get an estrogen when they do your FSH, because probably your estrogen was too high. Elizabeth, should we be thinking about mini IVF? How old are you, Elizabeth? So shoot back to me how old you are. Does it matter when the AMH test is done, or is it preferred at the beginning? It's preferred at the beginning, Victoria. But the nice thing about AMH, it's kind of pretty good throughout the menstrual cycle. It even works when you're on birth control pills. Hey, Jessica John Collins. Hi. You did my retrieval this morning. Okay. Okay. Well, I'll pray for you tonight. Okay. Amanda, they put me on birth controls to do a scheduled issues. I have 2 birth control babies. Wow. No, it's not going to mess anything up. Sounds like that's amazing. Okay. Nope. Birth control pills are not going to mess anything up. They're just controllers. They just help control the cycle. Okay. Wow, lots of great questions today, guys. Thank you. How does progesterone only versus estrogen protection birth control affect IVF? It doesn't affect it at all. I am 34. AMH is 1.8. FSH is 10. Gotcha. I would do a conventional. I kind of reserve the mini protocol for those over 40 because you have a lot of built-in potential. And remember, let me make it clear. When we do testing in medicine, we're hoping that it tells us something about the status of the person. But the real test for is IVF. Actually putting the patients on the medicines and watching that medicine affect you. So don't let a test result dictate your future. Now, that's my belief, that's CNY belief, that's what we do, and that's why we see so many patients who've been rejected by many, many places because they just look at numbers. No, the body is remarkable and mysterious and magical and quizzical, so don't be afraid. What factors dictate the dosage of low-dose HCG? Nothing. There is no such thing as low-dose HCG, Jessica. Here's the problem: is when the studies were done, they used 5,000 international units of HCG to say that it could do the job. However, they only made the 10,000 units, and I'm not sure why they only made 10,000 units. So for 20 years, we used 10,000 units, which was overkill. Then they decided, well, hell, we're wasting money. Why don't we sell 5,000 HCG units for the same price as 10? So now we call that low-dose HCG. I'm assuming you mean for trigger. I think you mean that for trigger. So 5,000 works. Lupron works. Yeah, you know Anna, isn't that was such a good time when I lived there. It's beautiful. What are the chances of having a baby with chromosomal issues if you don't have PGT testing? Karina, PGT testing it tells you which embryos are normal. So at 20, you have a 1 in 2,500 chance. At 30, you have a 1 in 1,000 chance of a chromosomally abnormal baby being born and surviving. At 40, you have a 1 in 100 chance, and at 45, you have probably a 1 in 10 chance. So at 39, you're probably 1 in maybe 150 chance. Typically, 99.9% of all babies are born normal because the body takes care of chromosomal issues naturally. We call it miscarriages, we call it biochemicals, we call it missed ABs, but the body is pretty darn smart. It's got about 10 million years of evolution to figure this out. Oh, sorry, Jessica. Okay, sorry, HCGLH. Okay. Now, this is going to blow your mind, but I have a strong feeling that HCGLH, which is trying to mimic Menopur, my personal opinion is it should be in the range of 30 international units, and lowering it doesn't help anything. That's no longer a mixed protocol. too complex to go into here, but I would hesitate, and as a matter of fact, all of my patients start at a minimum of 30 international units of HCG-LH because I'm trying to mimic a Menopur gonal-F cycle, but do it less expensively. So Menopur has 50% LH, or HCG actually, but 50%. So every 75 units has 75 units of HCG. Well, if you're only giving 10 units or 20 units or 30 units of HCG, it's quite different. So I'd say stick with about 30. If, again, there's, yeah, that's what I would say. That's what I would say. That's my opinion. Maybe somebody else has another opinion. All right. It's great, all these questions. Thank you. So I'm really looking forward, by the way, my name was there, Dr. Magarelli, Paul Magarelli. Looking forward to next week. It's going to be all about men, everything male. So husbands, boyfriends, fathers-in-laws, whatever. Fathers, just everybody can learn. We're going to talk about fertility. We're going to talk about testing and treatments. We're going to talk about sex, of course, because, you know, got to keep them interested. What they can do to enhance their OB. We'll talk about acupuncture. We'll talk about lifestyle choices, alcohol, tobacco, street drugs, hot tubs. Hi, Adrian. Good to see you, my dear. That's my absolutely amazing office manager here in CNY, Colorado, Adrian. Thank you for jumping on. Good to see you. And Jessica, I'm glad you're on 30. That's why I got a smile. Good. Britt, I'm currently on HCG-LH, day 7 of SIM. I was prescribed 20 years a day. Should I increase it to 30? Well, if you were a doctor, I would say, a doctor, prescribe it. It's not a matter of should, and that's where I thought I'd get into trouble. It's not right or wrong. It's a recipe. It's just basically a recipe. Hey, Stephanie, there's my fantastic acupuncturist. Okay, this is Stephanie King, just jumped on. She's our local acupuncturist, worked with Dr. Diane Credenda at East Winds Acupuncture. If you don't know, Dr. Diane Credenda is my wife, so there's a lot of bias there, but they are great. Even if I am biased, they are great. Thank you, Stephanie. Thank you, Adrian, for jumping on. But yeah, Britt, don't worry too much about, 10 units, 20 units, 30 units, 40 units. Let's see how you respond. And, every chef has a way of managing patients. That's just mine. Kayla, we were hoping to start a gestational surrogacy. We really are trying to have a girl. Is gender selection something that's, yes, absolutely, Kayla. It's called IVF with PGTA for family balancing. We absolutely do that. Lacey, anything to help conceive and just had a very successful tubal reversal. Avoid alcohol, tobacco, drugs. Download our family building guide. Look at the vitamins. Do acupuncture. Avoid carbohydrates, low carb, keto. Those are the things you can do. So absolutely, good luck. Did you get the reversal at CNY or just got a reversal? And did they test after the reversal to see if the tube was open with an HSG? Just curious. All right, let's see. In November, okay. All right. Family building guide. It's my dear Jessica. She's like the maven. She can just get us information, copy and paste it quicker than anyone I've ever seen in my life. Misty Miera had a consult in October. I never had a follow-up. Doctor did not call. We don't call you. What you do is you call on the first sign of your period, and then you get a follow-up. I have PCOS, can't get my period regular to get testing done to see it. Okay, so there's the issue. So simply call us. If you have PCOS and you have irregular periods, every 28 days you call the clinic. You call because you're not having periods. So we'll get them started. Okay, we'll get them started. Lacey, yes, love them there. They tested everything and said everything was perfect. Good at CNY. Good. Is melatonin for several months actually helpful for egg quality? There are some studies, Elizabeth, that suggest that. I've never been there's not a lot of studies on it. It starts with the egg is a book. I think a better book would be It Starts with Bacon, but who am I to say? Yeah, there you go, Jessica. That's for the lady who didn't, Misty. Okay, yeah. So call the 844-315-2229, press 3, and then press 2. and then magically you'll get all of the answers to Universe's questions and stuff. That's great. But yeah, guys, you have to be the proactive in contacting us. We get approximately 3,000 phone calls a day, and I think we're up to about 20,000 requests for care a month. So the best thing is stay on top of your portal messages, call. If you haven't heard anything and your period starts, you call us. Well, but Misty, the testing, if you don't have periods, they can start your period. Right? They can give you medicines to start your period. Or just get another doctor consult. You know what? If you're finding a difficulty here, just ask to speak to a doctor. All righty. Regarding keto, I've been doing keto for 2 months, but I've fallen off the wagon. Well, Karina, keep your carbs less than 50 grams a day. Avoid white potato, white rice, white cereal, white bread, sugars, candies, cookies. You can do vegetables, above the ground, green, crunchy vegetables are the best. But keep your carbs about 50 grams or less a day. Chrissy, I have no ovaries, but I have my uterus. I'm interested in embryo donation. What meds would I be put on to prepare for the transfer of estrogen and progesterone? I'm regular. This is Lydia. IVF at the end of April. Should I ask to be on birth control, take Provera, or just wait it out until I go for baseline? Go to baseline. I don't want you on Provera anymore, please. Rebecca, I have my tubes tied. My husband and I want to have a baby. Is it better to have them untied or do it this way? I'm assuming you mean by this way, you mean IVF. Well, the chance with a tubal reversal is about 2, 3, or 4% chance per month to achieve a pregnancy. If you're in your 30s, the chance for IVF to work is about 30%. And if you do genetic testing, it's around 60%. So you look at those numbers, but when someone says to you, you have a great chance of achieving a pregnancy after your tubes are reversed, you might ask them what that number is, because that number might be 2%. So the problem with the way the data is done is they're doing it with very young people and doing it over years. Well, nobody does pregnancy rates. It's pregnancy rates per month. That's the question to get an answer to. So, all righty, we are closing in at 7:30. So please, everybody, let's get as many mails as possible. It would be fabulous to get as many mails as possible on our Everything Mail lecture next week. I'm probably going to not take questions. I'll probably, do a half an hour lecture and maybe a half an hour questions. And please, we'll try to focus on the mails. The mails, they're critical. We are working desperately to get our males to go to acupuncturists, to Chinese medicine doctors, to the healing arts centers, to Dr. Credenda. Why? Because there's over 5,000 articles written about how Chinese medicine helps sperm and fertility. Even some radical stuff that really is remarkable how it works. So start spreading the news. We're doing mail, okay? So next week will be all about the mail. It'll be fun. It'll be somewhat pornographic because we have to show slides and stuff of anatomy. So don't let your children watch. Okay. Oh, thank you, Karina. My pleasure. You can get your monitoring, Elizabeth, absolutely, in Atlanta. They can help you with the testing, absolutely, and then go to Albany for your, yeah, that's perfect. Perfect. Have I considered getting an acupuncturist in the clinic now that we have more room? Absolutely, but we first have to build out the new laboratories. We have to expand our procedure rooms. We're up to almost 120 cycles a month. We were built around 30 cycles. So we're focusing on that, but yes, that's down the road. And Julie, I've been seeing more mails. God bless you. I'm so glad. That's really important. And Julie, of course, is an acupuncturist. So fantastic. All right, folks. I've been talking a lot. I hope you got something good out of it. Of course, you could always send me kisses. I love kisses, so that's always a nice thing. Again, next week is all about the male, so it's going to be really good. And bring your experiences and bribe them or something to come on. And thank you for joining me today. It's been amazing as usual. And then in the very near future, I'm going to have some interviews with our lovely acupuncturists, Dr. Diane Credenda and Stephanie King. Dr. Randy Fink, man, he's on board, baby. We're really excited. He'll be here full time, we think, starting the first week of May. Right now, he's every 2 weeks, so that's exciting. And thank you for sharing your evening with me. I hope it was helpful. I certainly, I always get a lot out of these, your questions. Thanks for the kisses, Martine. I appreciate it. So I'm going to sign off, and please be well. Do take the COVID vaccine if you have options to take it. Again, they said there is no impact on fertility. This is published stuff out of the British Fertility Society. There's no impact of the vaccine on fertility. It's recommended for pregnant women, breastfeeding women, people trying to get pregnant, etc. So have a wonderful, thank you. You're welcome, everybody. Be safe, and I'll see you guys in about a week. All right. Remember, males next week.